Hi, everybody. Welcome. So Dr. Green is going to be our speaker today, and Dr. Green has been a developmental optometrist for over 16 years, and she specializes in working with children with special needs and on the autism spectrum. She's amazing, and I'm so looking forward to hearing what she has to tell us today. So if you have questions at any time, please go ahead and put your questions in the chat, and when we get to the end, we'll answer all questions. Dr. Green.
I'm just going to share my screen here. Hi, my name is Dr. Mehrnaz Green, and I'm a neurodevelopmental optometrist at the Vision and Conceptual Development Center here in Chevy Chase. And I'm going to be talking about vision's effect on educational testing. Or I'd like to be talking about it. Let's see, there's a lag. So I love to show this picture because when I was in elementary school, I was taught that the eyes work like a camera, where light focuses through the lens of the eye and casts an image on the neural tissue of the eye called the retina, very similar to how a camera works. And when we get a routine eye exam, this is the model that most eye doctors have adopted. They're concerned about how clear that image is, if you need glasses or contacts, and how healthy your eyes are. These are important, but we actually have two eyes that see two slightly different pictures, and our two eyes have to coordinate and work together as if there were one eye sending images to the brain. We process what we're seeing and understand what we're seeing in the brain. So although sight occurs in the eyes, vision takes place in the brain. There are more areas of the brain dedicated to vision than any of the other senses combined. Most of the brain is involved with vision, so vision development becomes a very critical component to a child's overall development. Over 70% of all sensory information is visual. The visual system sends the brain over 400 times as many messages as the auditory system. If you're an auditory learner, you're not working as efficiently as a visual learner. Vision gathers more data per unit time. The first stage of our digestive process is vision. Vision is so dominant that we frequently close our eyes to enhance our appreciation of sounds, tastes, odors, and textures. 35 different areas of the brain are primarily or totally involved with the processing of visual information. Every lobe of the cerebral cortex is involved with the processing of visual information. Vision plays a critical role in a child's overall development. If vision doesn't advance properly, the other developmental delays may seem impossible to improve. In the same way, an individual can have delays in motor and speech functions, there may be delays with visual function. So how common are these vision problems? 1 out of 4 students have visual problems that are serious enough to impede learning. In special populations, up to 85% have vision problems that interfere with learning. 62% of people with dyslexia were found to have a treatable vision problem. People with ADHD are 3 times more at risk for vision problems. So how does this happen? Although children receive a vision screening at their pediatrician's visits, most vision problems go undetected because most people think 20/20 equals perfect vision. typical vision screening only identifies about 5% of vision problems in children. Let's briefly discuss the different types of eye doctors. An ophthalmologist is an eye surgeon. As such, is a medical doctor trained in disease and of the structure of the eyes. And when a child sees 20/20, they consider it perfect vision. The ophthalmologist is an eye surgeon, so the emphasis of their training is on the structure of the eye and eye diseases. An optometrist is an eye doctor who is also trained in disease as well as visual functioning. The emphasis is on how we use our eyes in daily life. So emphasis in our training is on visual function. Many optometrists also test distance only in children and often tell parents their children have perfect vision when they see 20/20. Within optometry, some doctors pursue additional training in the diagnosis and treatment of vision problems that interfere with reading and learning, whether it's due to a delay in development, a head or brain injury, or otherwise. Less than 2% of all eye doctors have this board certification in vision development and vision therapy. Dr. Zeller and I are both board certified. Developmental optometrists test all the visual skills critical to reading and learning. There are at least 17 visual skills that are critical to reading and learning. For example, let's think about what happens in a classroom. The child sits there at their desk, they have to look at the board, then they have to look at their notes on their desk, they have to remember what they just saw on the board, and then they have to write it down in their notes, and then they have to look back at the board, then they have to look at their teacher. The point is they're using their eyes all day long. So let's talk a little more specifically about the visual skills that are needed. Here we have a list of classroom tasks and the 17 visual skills required for reading and learning. As you can see here, being able to see clearly is just one of those skills, which is highlighted here. To give you an idea of how we use our eyes for reading and learning, I'd like to show you some demonstrations. When we look at something far away, our eyes should be looking straight ahead. When we look at something up close, our eyes have to converge and point at the same place at near. But when the eyes are not working together, it affects how we see. Here's what it can look like when you have challenges coordinating your eyes to work together as a team. So how do eye movements affect reading? Well, we have to look at the word, and then we have to smoothly track the words till we get to the end of the line. And then we have to make an accurate jump to the beginning of the line, next line. Can't lose our place, can't reread the same lines. It all has to happen automatically. When someone has a problem with what we call tracking, letters can look like this. Oops, I did not mean to do that. I touched something funny. Sorry about that, guys. Children typically don't complain when they have trouble seeing because they assume everyone sees the same way they do. Therefore, parents, clinicians, and educators need to know the various behavioral signs that signal a vision problem. And remember, patients who have these vision problems will often pass a vision screening. The 5 most common signs that a vision problem may be interfering with learning are, number 1, skips or rereads lines, 2, poor reading fluency and comprehension, 3, Homework takes longer than it should. Also reverses letters like B and D when reading, and short attention span with reading and schoolwork. What is important is that we are making sure that all the visual skills critical to reading and learning have developed properly. What is the difference between a developmental vision eye examination and a regular eye exam? A regular eye exam is about 40 minutes or less and tests how well you can see the chart as well as the health of your eyes. A developmental vision evaluation is between 2 and 4 hours long and tests all the visual skills critical to vision and learning. First, we have to make sure that the child has healthy eyes, no signs of disease, and a healthy brain. The next step is to make sure that the basic binocular visual skills are in good working order. The vision skills responsible for eye pointing, teaming, eye alignment, focusing, image clarity, and getting a decent image to the brain. Then once the images are getting to the brain correctly, the next step is to make sense out of what one is seeing. Visual perception is the mental processing and manipulation of the image for understanding. If this image is being interpreted correctly, now the child is ready for cognition and comprehension. And when you get a routine eye exam, you're taking a look at healthy eyes and eyesight. And when you have a developmental eye exam, you're taking a look at all of these pieces. Several years ago, I attended a conference and had the pleasure of hearing Dr. Linda Kreger-Silverman, a psychologist who directs the Institute of the Study of Advanced Development and the Gifted Development Center. She beautifully summed up the need for educational testing. To what extent does the discrepancy between the child's strengths and weaknesses cause and interfere with the full development of the child's ability? Dr. Silverman carefully went through typical IQ testing and how it can be affected by vision problems. This opened my eyes on how IQ tests can show a need for vision therapy. Here are some signs that the person may have a problem and would benefit from vision therapy. Verbal subsets are 6 points or 2 standard deviations higher than the visual subsets. Slow processing speed, significantly poorer performance on time tests, able to complete items correctly after the time limit, difficulty visualizing, difficulty with working memory, becomes overwhelmed with the blocks or puzzle pieces during visual spatial tasks, talks through visual tasks or moves lips, becomes angry during visual tasks, saying things like, "This is impossible," or embarrassed during the visual task, like, "I'm not good at this kind of stuff." Excessive blinking or eye rubbing, turning or tilting head, closing or covering an eye. During block design, they're unaware that all the blocks are alike, becomes overwhelmed by the task, approaches the task randomly. After they place a block in the right position, they move it, reverses the red and white on angles, extends the blocks beyond the 3x3 square. Design is rotated, tilted, or flipped, places all the blocks on an angle and then shifts them into the correct orientation, silently vocalizing while completing the task, says designs look right when it's inaccurate. During coding, difficulty orienting the paper, places their face close to or far away from the paper, not using their helper hand to hold the paper, difficult to form letter-like symbols, makes reversals, During symbol search, do you see excessive head and body movements rather than eye movements? Using fingers and or pencil to keep place? Rubbing and or blinking the eyes? Moving close to the page or further away? Turning or tilting the head? Twice exceptional children are frequently misdiagnosed. They are compared to norms for average children instead of their own strengths. Their lower scores may not be below the norm and are sometimes above average, but compared to their verbal abilities, those are areas of relative weakness and they're holding them back. Their verbal ability compensates for some of their lower scores and inflates them. The magnitude of the discrepancies between their strengths and weaknesses are not considered. Adequate vision is inadequate for gifted children. The goal of vision therapy for the gifted child should be to enhance visual abilities. Children with much higher than average verbal intelligence need much higher than average visual processing skills to actualize their gifts. And that's another quote from Dr. Silverman. Next, let's talk a little bit about our office, the Vision and Conceptual Development Center. Harry Wax was the founder of our practice, and we worked together for 7 years. Harry taught me that vision is the foundation of cognition. He worked with Piaget and integrated stages of Piagetian cognitive development with the development of vision. He coined the term visual cognitive therapy as his most specific type of vision therapy that we do in our office, and it integrates sensory motor and cognitive hierarchies to strengthen vision development. Dr. Wax showed me the importance and the magic of engaging patients and appreciating where they are developmentally rather than where they are not chronologically. Dr. Wax wrote 2 books, both with psychologists. Thinking Goes to School was his first book, and he wrote it with Dr. Hans Firth, a developmental psychologist. This includes Piagetian theories of development and vision therapy procedures. His second book, which I highly recommend as well, it's a great book. It's called Visual Spatial Portals to Thinking, Feeling, and Movement. And he wrote it with Dr. Serena Wieder, who's the co-founder of DIR and Floor Time. In the first half, Dr. Wieder discusses some social emotional challenges that are caused with patients who have visual spatial challenges. And the second half of the book includes vision therapy procedures. Dr. Wax also worked with Dr. Molly D. and myself on an article about visual cognitive therapy with patients on the autism spectrum, which is also a specialty in our office. So what is the impact of visual cognitive therapy? We see improvements in reading and math, sports, ability to read social cues. We see improvements in processing speed and overall IQ scores as well. And most importantly, we see improvements in confidence of our patients. Visual cognitive therapy is presented at an appropriate developmental level. It's presented in a way that is meaningful and interesting to the patient, and it's tailored to meet the child's unique needs and individual differences. We are not working with the eyes, we're working with the mind. So changes through vision therapy are happening in the brain. Dr. Tara Alvarez at the New Jersey Institute of Technology has published significant research showing the improvement in brain function in functional MRIs in patients pre and post vision therapy. And what you see here at the top is a patient who has poor eye movements. And this is what their functional MRI looks like. And after 6 weeks of vision therapy, their eye movements have improved dramatically. And we see that the brain is lighting up quite a bit more. There's better functioning that's happening in the brain. And here's another example of improved brain function with improved vision function. Now in our office, we do not perform functional MRIs, but we do perform visual invoked potential tests, VEPs. This is a picture of me with the electrodes on my head. A patient looks at a specific light signal as shown in the picture with the checkerboard, and the electrodes measure the speed and strength of that signal that travels from the eyes to the brain. So we can monitor that signal to make sure that we're making it stronger and faster with vision therapy. Another tool that we have in our office is an eye tracking device called Right Eye. You can see normal results on the left, normal fixation, smooth, slow eye tracking, and rapid eye saccades. And on the right, you can see the results of someone who has challenges with these eye movements, which will cause slower processing speed and challenges with learning and in general function as well. We are also able to perform reading tests using the right eye and see how the patient's eyes move as they read and compare their scores to age norms. So again, typically children don't complain when they have trouble seeing because they assume everyone sees the same way they do. Therefore, parents, educators, and clinicians need to know the various behavioral signs that signal a vision problem. So here are the ABCs of vision difficulties. A is for appearance: closing an eye anytime, excessive blinking, squinting, tearing, redness, and swelling. B is for behavior: poor attention span, poor tracking, poor eye-hand coordination, poor eye teaming, confusion of shapes, learning challenges, holding a book very close or very far away. And C is complaints: eye discomfort and fatigue, headaches, burning, itching, double vision, dizziness, and blur. When working with a person with learning challenges, it is important to understand that vision is a piece of the puzzle to fully understanding that child. In addition to Dr. Wax's 2 books, here's some additional books I recommend to learn more about vision's role in learning. The first is by Dr. Schumacher, Vision and Learning, a Guide for Parents and Professionals. The next is The Hidden Link Between Vision and Learning by Wendy Beth Rosen. The next is When Your Child Struggles by Dr. David Cook. And the last one I recommend is The Mislabeled Child by Dr. Zeddy. For more information, these are some excellent websites. The first is our office's website, visiontherapydc.com. The next is College of Optometrists and Vision Development, COVD. COVD provides board certifications for developmental optometrists. And the last is American Optometric Association, AOA.org. It's been a pleasure talking to you today. Thank you so much for your attention. Please let me know if you have any questions.
So if people want to raise your hand, you can do that. There's a raise your hand, or you can put any questions in the chat and we'll answer them. Or if you want to go finish your lunch, you could do that too. Yes, we will be sharing the slides of the presentation. After, we will send out a link with the PDF and with the recording if you like. I think you must have answered everybody's questions, Mary. Going once, going twice. Thank you so much, everybody, for attending.
Is there one from Dana Grasso?
Is that popping up? Because I'm not seeing it on the. Do you want to unmute and ask?
Oh, I think I have it. It's about advocating. Well, thanks, guys. I'm getting a lot of thank yous. Let's see. Dr. Grasso, did you want to ask your question publicly, or did you want me to talk to you privately?
Hey, sorry. I had to put myself back on. Thank you for doing this. I was just hoping you might be able to talk to us a little bit more about, being that interface potentially between knowing a bit about the work that you do and then, interacting with folks in school settings, and how we could kind of best describe, advocate, suggest to folks in school, kind of on those initial front lines, teachers, administrators, learning specialists, about how they can access,
Mary, you're muted. Okay.
Did you want me to answer that, Amanda? I thought you were going to answer.
Please.
Okay, so we're happy to provide in-services, Dana, if that's at all helpful to the teachers. I mean, we're happy to do kind of a lunch and learn, like we're doing this. I have a separate talk, obviously, for different populations that I speak to, different audiences. So I'm happy to do like a webinar that's geared towards schools and teachers. In fact, a lot of the schools have asked for that, to get like some specific examples of how they can be looking for it in the classroom. So I think one of the things that's very helpful to parents when they do get the referral to come see us is just talk a little bit about how this is different than a regular eye exam. So I think that's very, very helpful, because I think a lot of times, especially if they see an ophthalmologist, they're like, well, I've seen the surgeon, but which is great. And I think that there's lots of times I refer to ophthalmologists, but when it comes to understanding how vision can affect learning, that's not what their training is in. So I think that helps when the parents understand that it's a different exam. And I think once they come in for the exam too, they see how it's so different. And when they see that their child is having challenges seeing, they are able to appreciate it more. But in the classroom setting, sometimes accommodations are very helpful. So sometimes teachers start with accommodations, and when they find that, wow, the child does so much better if I enlarge the font or I increase the spacing, it's an indication that there's a vision problem too. So sometimes some of the teachers I know have been trying that first, and when they see that there's a huge difference, I know that there are teachers that actually have given reading glasses to the kids, and there's a huge improvement, and they're like, listen, like there's clearly something going on. If I magnify it and they see better, that they're all of a sudden they're reading better. So, but we're happy to communicate with them too. If you see something specific with a child and the school might be a little bit resistant, we're happy to do in-services for them.
Serena, how are you?
Hi, good. How are you? Thank you, Mary. That was terrific. A great introduction. And thank you for mentioning the book, of course. We all worked with Harry for many, many years. I just wanted to really highlight some of the emotional impact that some of these visual challenges have. I've seen your wonderful work with so many of the children I've referred and worked with simultaneously. In fact, the book describes many of them. And very often we see, behavioral challenges, emotional challenges, because it is so frustrating and so difficult. And there are so many school behaviors that, show us these children are lost in space and they're on the edge of the playgrounds and they are avoiding, things that relate to, functioning in the classroom. Um, and it really is overlooked. It's overlooked in children in professionals who are learning about development. And it really has and continues to require a lot more attention. So um, all I can say is it's actually the first thing I look at because it really is so central, so essential. And you provide wonderful intervention and work so well with other team members because it does take a team since the impact is so broad on learning, on testing, on socialization, on really just every part of life. Our vision comes in first, and I'm really happy you're doing this, and I look forward to doing our course with you. And we'll be offering a 6-week course on visual spatial functioning as it relates to the big picture of development in different ways. So thank you. It's
Yes,
great to have
we're
a chance
coming
to see you.
Yes, that'll be coming up in Profectum. So
Yes, at the Perfectum Foundation, right.
thank you so much,
Good
Frida,
thing
for
to
talking about
mention.
your experiences. I appreciate that.
Oh, not at all. And I really think there just aren't enough people. When you said 2%, I was a little shocked, really taken aback.
I think it's less than 2% actually.
It is.
That's really remarkable, and we just need more and more. So any way we can help you get the word out, we will. And
Thank
I
you.
hope
Fortunately, a lot of the optometry schools are adding more curriculum to get more of the students interested in developmental vision issues. And the COVD organization that Mary mentioned is doing a lot of outreach to the students.
Yeah.
So we are seeing like increased interest. So
Okay.
that's good.
I mean, what I find, and I know several, people think they already know it. And, because they're doing some eye exercises or, tracking or convergence, unfortunately, they don't really attend to the whole child and the impact it's having and look for other ramifications.
Mm-hmm.
And that's very similar to all developmental fields. You think you know a little bit, you think you know it all, and it's far from the case. Far from the case. That happens a lot with floor time, happens a lot in DIR, and we just have to keep persisting. And hope the parents and families we work with spread the word for how beneficial this can be. And it continues. I mean, it's a lifelong issue. So if you don't get help early, you're going to keep encountering challenges, with it.
That's true.
Yeah.
Thank you, Serena.
Thanks so much. No, I was delighted to get your card and see the announcement. So, and it's good timing.
Excellent. Excellent. We have another question from Audrey. How much does resting nystagmus impact vision? And what recommendations as far as strategies and interventions within the OT scope are there for working with clients with resting nystagmus? So nystagmus can play a huge role. So if you think about what happens as your eyes move, you're going to, number one, have a reduction in the best possible visual acuity, just because the eyes are constantly moving. So that's actually one of the tests we do, particularly with our brain injury patients, is to see how much of a difference there is when they're reading the letters versus how they can read the letters when they're moving their head. So people with nystagmus, because most of the time, with children at least, they've had it since they were born, they're going to do a little bit better in terms of acuity than someone who just recently acquired a nystagmus. However, it does place limitations. So where we see challenges is you don't get the same type of normal binocular or two-eyed depth perception just because you don't have a stationary image. And you also, because of those acuity challenges, they're going to have more problems reading and doing anything that requires sort of like detailed visual work. So to start with, for any type of reading issues, enlarging the print is going to make a huge difference, and increasing the spacing between lines of words is going to make a huge difference. Also reducing visual clutter. So if they're reading from the board, if they're reading, from a paper or from a screen, anything that you can do to simplify what they're looking at and take away extraneous stuff, that's going to help. There are techniques to actually reduce the amount of nystagmus a person has. And there's different techniques depending on, the source of the nystagmus, if it's something they're born with, et cetera. But that right eye that Dr. Green put up, you can see the movements of the eyes. We have another device called a visograph that's pretty similar for the reading aspect of it, but you can also use it not just as a testing tool, but as a training tool. And we've successfully worked with a few patients who have nystagmus to be able to decrease the amplitude of the movement. So instead of having like a rapid movement of the eyes, they have a slower movement that they're more able to control. There are some other techniques too, because a lot of times people with nystagmus will have like a particular place in space where they're looking that the nystagmus decreases. So for example, if looking to the left decreases their nystagmus, sometimes we can put glasses on the person that create some prism so they can move their eyes to that null point is what it's called, without having to turn their head all the time. So a lot of times with a kid with nystagmus, you'll see them, putting their head in an unusual position to try to put their eyes in that null point so that they can see better. But if we could do it with glasses instead, that will save them a lot of neck and back issues down the road as well. So thanks. Oh, yeah. Okay. So someone else had a question about like, what are we doing differently with COVID? So that's a great question. So yeah, in the past, we were having 5 therapists in the office, or up to 5 therapists at a time. So it was definitely a busy place. So right now, what we're doing is we've reduced our capacity. We have at the moment, 2 patients in the office at a time. We're not letting parents bring in, like extra kids and things like that. So it's just one caregiver at a time. For our testing, we have moved as much of it as possible to virtual. Obviously, a lot of it you can't do virtually, but what we can do virtually, we have moved to online. And we're doing all the parent conferences over Zoom as well, so that we can reduce that contact time. One of the things that we started doing actually 2 or 3 years ago was doing vision therapy over Zoom. And obviously you're not going to have the same experience as you have in the office. And there are a lot fewer, far fewer tools to work with. So making it fun is definitely more of a challenge for my therapist. I mean, they're on here, they could tell you that. But we've had really good success with patients. I would say the number one challenge is that it does require more parental involvement for the therapy itself. So, if you've got a 15-year-old or an adult patient, we can do that very easily without having that extra parent support. But for younger kids, the parents have to be more involved in the therapy sessions themselves. But we've had really good success with that. So any other questions? I don't know if there's some that are in your chat, Mary, that aren't in mine. You're muted.
I don't see any.
Okay. Thank you very much, everybody. Thanks so much for joining us today. We will be doing more webinars in the future. So if you have specific suggestions, you could put them in the chat, or you could email them to us. We will also be sending out a survey afterwards. So if there's any other topics that you're interested in hearing about, please let us know.